Chief complaint onset mechanism will always be given to you. Obvious deformity, when you get to the Chicago Bear guy, he might have been dislocated. But most of the time, you're not going to see a whole lot of obvious deformity. How do we do a sweep test? We're looking right here. We haven't done this in class yet either. I'm going to sweep, and then I'm going to push. So you say, well, where do I push on this other side? Here's my kneecap. And if they're swollen, you're going to go just kind of underneath that kneecap and push. So this area right here is where you're looking for that push right there. And it'll go bloop. It'll pop up just like that. It might even make that noise. So if you go like that and you push, you're looking for and feeling for a ploop. Okay? So, sweep test. Now, as soon as I get through with my sweep test, I'm going to find my patella. I'm on the superior pole, quadriceps tendon, superior pole. Inferior pole, my patellar tendon, all the way down to the tibial tubercle. I'm going to push them medially for that medial border MPFL right there, right? Then I can go right to here, and I can just go right along that, see if they're plica sensitive, okay? Depending on where they're telling me they've got pain. So we did superior pole, patellar tendon to the inferior pole, patellar tendon, tibial tubercle, MPFL, medial border. Now, once I've got them here, I can do my apprehension and my patellar grind. Maybe I went down and did my little stutter test right there. So how do I do my apprehension test? I've got to take my fingers. I'm on this side. Most of our things on the thing, we see them doing over here. I'm just going to push them out that way. I'm going to try and push them out that way. For my patellar grind, I'm going to push down into the trochlear groove and move it just like that. Okay? All right? So I can do everything while I'm here. Sweep. And then I'm going to go superior pole, inferior pole, patellar tendon, any pain with that. I can come back and hit that again in a minute as well. Push them medially, medial border, MPFL, stutter. How about if I try to push you out here? Patellar grind. Okay, so looking for my patellofemoral stuff. A lot of stuff that we went through with the on the slides. You know, there were a lot of other things that we can do if we want to dissect. But if someone's coming in to me and telling me their knee hurts, I'm not going to have them do a step-down test and all those different things. But initially, we can look at that. Okay? So there, we started that with the palpations. Then I'm going to bend them up. They may not like to bend up, but we're going to put them in that 45 and 90. How did I say to find the joint line? I'm going to find my patellar tendon, joint line, push back, my tibial plateaus, make sure I'm there, set them down, have a seat. Coming on this medial side. If I'm on the medial side, medial meniscus, medial collateral ligament right there, down to the pes, okay? If I want to test that pes, turn their foot in, which I'm having you do, pull back for me. I can find that hamstring and check it right there. So I can do my medial plica. On the lateral joint line, any pain over there, medial lateral meniscus, lateral collateral down to the fibular head, right? IT band. Just go ahead and stand up, do the IT band right there while you're there, okay? So, MCL, you did medial joint line, medial meniscus, MCL, PES, lateral joint line, LCL, IT band, noble compression. Now I'm just gonna have them, can you bend your knee up? They may or may not like that. Take their knee all the way out. What do we say we do here? Quad set, straight leg raise. I want to see, especially for my patellofemoral issues, can they make a good quality quad? If I've got someone with swelling, they're not going to want to make a quad set either. Someone with an ACL do not like to do that. They don't like to make that tight. Okay? So all I do here is a quad set and a straight leg raise. Now what I do, I'm going to take them into passive. Remember, our meniscus type people, even torn ACL, do not like deep extension. That's where our injuries are going to happen, down in that posterior femoral condyle, posterior meniscus. They don't like that. So while I got them down here, I can go ahead and go straight into my O'Donoghue's. So I've got my fingers on the joint line. I'm pushing them. Number one, is there pain in deep flexion? Then I can rotate them. Do you hurt where my finger is or my thumb? And then slowly take them down into deeper, and they don't like it. Externally rotate. Valgus stress, McMurray's. varus stress McMurray's. Okay? So I can do all that while I'm palpating. Knee flexion, O'Donoghue, McMurray, and then knee extension. I'm going to bring her out. I'm going to support her, and then just ask her if she does or does not like that. Those are all provocative exams. Does it recreate pain? Once I've got her there, I bend her up here like that, and I'm straight into my modified lockers. I got her here. Boom, boom, boom. Okay? Now, we haven't done this yet, but I get her off the edge of the table. Got my hand here, 0, 20, 25 degrees, valgus. 0, 20 to 25 degrees, varus. Okay? Then, you know how they had them? Now, I've seen doctors get them up here like this. Come up here, valgus, do it like that. And then for the varus, they'll come in here like this and do the same thing. Okay? So you can support it like that. But out here in space, you know, you can do it here, but you got to be careful about that. So I like to take them off the edge of the table. It helps support. And then when I'm doing that, I get a little bit of traction on here. We'll do those tomorrow. We're going to do all those, so you'll be ready for real time to do that. Then I'm going to flex her up. Oh, it's not on there. And I'm going to do my anterior and my posterior drawer. Okay? Anterior, posterior drawer. Any tingling numbness? Distal pulse. Okay? So that's what your real time is going to look like.
So we don't have to do a slocum?
No. Okay?
In real time?
No, in real time we're not going to do that. So we did modified Lockman's, valgus, varus, anterior, posterior, any tingling numbness, and then check pulse.
Like what?
Okay? Everybody good with that?
Oh, Jesus. Oh, no, don't throw a fire today.
Okay? Everybody cool with
Can't
that?
throw fire today.
Okay, so
No.
before we go,